So this is the second part, and I'm going to describe some of our work where we've looked at clinical outcome and prostate cancer using PTEN fish. This is a cohort that we examined based in Brazil, over 100 men with prostate cancer, measuring recurrence based on time to biochemical recurrence as measured by PSA. And you can see that a proportion of the patients had metastasis. This is a typical distribution of pathology stage, Gleason score, and so on. So the cohort was quite typical and representative of the situation that we have in North America. This is the result of the fish, and it was actually done on a tissue microarray, so that you can see here the tissue microarray cores. And we used two-color fish probe, with the control probe being situated here at the centromere and the PTEN gene here. Control centromere is green, PTEN is red. And this, something like 56% of the tumors had the normal 2 copies, so you can see 2 red spots and 2 green spots. About 40%, so 42 out of 107, had lost a red spot, so this is a hemizygous deletion here. You can see that quite clearly. And 5 out of 107 had a homozygous deletion. They'd lost both copies of their PTEN gene. And so this is one of the first studies to demonstrate that there was a significant presence of large losses, genomic losses of PTEN in prostate cancers. Looking at the time to biochemical recurrence, you can see in enormous enrichment of the patients that had biochemical recurrence here in this group, so 33 compared to 25 had a deletion. The ones without a biochemical recurrence, over 14, only 14 out of the total of 49 had a biochemical recurrence. So you can see that increase. Interestingly, when we looked at the time to biochemical recurrence using Kaplan-Meier predictors, you can see here a much earlier time to recurrence if both copies of the PTEN gene are lost. A more marked recurrence by PSA if 1 copy was lost, and without a loss of PTEN, the line is up here, so a lot less biochemical recurrence, as you might predict. So this was published in the British Journal of Cancer, and this is the title, and we also looked using multivariate Cox logistic regression. You can see hazard ratios here for PTEN deletion, so no loss, hemizygous 1 copy loss 1.96, homozygous loss 11.26, and these are the hazard ratios looking at standard surgical measurements. Now, also as part of the study, we were fortunate enough to have 10 matched primary adenocarcinomas and accompanying regional lymph node metastases, so a subset analysis. And what we found was that 9 out of these 10 tumors had lost a PTEN, lost at least 1 PTEN. Hemizygous deletion was present in 4 out of 10, and a homozygous PTEN deletion in both the primary and the accompanying metastatic lymph node in 3 out of 10. Significantly, 2 out of 10 tumors with a hemizygous PTEN deletion in their primary tumor had a positive lymph node metastasis, which had acquired a second PTEN loss, so they'd become a homozygous PTEN deletion. So this really shows the transition of 1 copy loss to 2 copy loss, going from the primary tumor to metastatic tumor. So this was really very compelling that this was an important change, not only at the beginning of the prostate cancer process, but also a second loss occurring, an accompanying onset of more aggressive metastatic disease. We also, this is a study from the group at the Marsden. This is from Reed et al., published in the British Journal of Cancer last year. They also did a 2-color fish assay, and they grouped together 1 copy loss and 2 copy loss. So they classified them as either PTEN lost or normal, so they dichotomized essentially. And you can see this is the time to death. So this is survival analysis, and you can see reduced survival in the patients that had lost 1 or 2 copies of PTEN compared to the patients that in their tumors had not lost PTEN, and the hazard ratio for 4.87. and a significantly large study, 322 patients, so 56 out of 322 had a PTEN deletion. These particular tumors were obtained in a slightly different way. So this was I guess opportunistic discovery using TERP biopsies, so slightly different to the cohort that I just described from Brazil. So that may be one of the reasons why the percentage of PTEN losses is slightly lower. They also compared PTEN loss to some of the other molecular losses by fish, and the common one, of course, is the fusion gene, the TMPRSS2 ERG fusion. And you can see here that the presence of PTEN loss was the strongest effect in terms of survival. The second most was PTEN loss with this fusion gene, and then you can see here the survival for tumors that didn't have either PTEN or the fusion gene. And so our conclusion at this stage was that PTEN loss is one of the highest factors in terms of overall mortality, and this is a conclusion from our lab and also from the lab in the UK. And so in the next presentation, I'll talk a little bit more about some of the changes in assay design, specifically the 4-color fish assay. Thank you.